Myself, Dr. Swadeep Srivastav, I represent HEAL Foundation. Today we have gathered here to discuss on a very interesting subject and topic, that is on cardiovascular diseases, scientific ways of mitigating key risk factors. We have a very distinguished guest from our very friendly country Israel, Dr. Professor R. Zimlickman. Sir is the director of Bronner Institute of Cardiovascular Research, Sackler Faculty of Medicine, Tel Aviv University, member of the board of directors, the Israeli Society of Prevention of Acute Myocardial Infarction, Ministry of Health, Israel. We all know Dr. Chandrakant S. Pandava. He got Padma Shri 3 years back, also known as Iodine Man of India. Dr. Kanwalpreet Kochar. She is the professor and head in charge of Cognitive Neurophysiology and Nutrition Lab in Department of Physiology, AIIMS, New Delhi. And we have another special guest and speaker, Dr. Mohsin Wali. Dr. Wali, please let's give a big hand, is also a Padma Shri. He has been honorary physician to the President of India.
You all know that even in India, young adults, 30 years, 35 years, collapsing in the gym, not having the drive to do, in a balanced, moderation way, but to do more and more, driven personalities. And it is becoming almost like an epidemic now of obesity. And when we say obesity, we don't limit ourselves to one word. We are primarily talking of metabolic syndrome, which means cardiac ill health, dysautonomia, hyperlipidemia, hypertension, and heart disease.
Nearly two-thirds of the cardiac arrests occur at the first clinically manifested event in the clinical setting of known disease, strong risk predictors. We are talking much about heart failure these days because it's not recognized by even good physicians. So we have a new term, heart failure with normal ejection fraction. Sometimes due to more exercise, the heart becomes more healthy. That's also a disease. I tell you, the best 6-7 ways to be happy is think positive, avoid anger, avoid negativity, do some medication in any form, have a good quality sleep, and leave hatred, jealousy, and help people so far you can have, and do moderate physical activity, nutrition, manage your obesity and weight. And there are options to decrease. Absolutely no to smoking. Maintain your blood pressure. Maintain your cholesterol.
Try to concentrate about one of the worst habits of humanity, smoking. Are they really modifiable? If they are modifiable, how come we have so many patients that smoke? How come we have so many obese patients? Those that were able to stop smoking, stop. Those that were able to stop drinking alcohol, stop drinking. However, this still is a major health problem of the whole world. For instance, we have in the world today 1 billion of smokers. They know it's unhealthy, they know it kills, they know they should stop. Some of them try and do not succeed, or stop and start smoking again. Smoking is the second killer of the population on the globe. So, of smokers diagnosed with coronary artery disease, 49% continue to smoke. Those that had a stroke, 57% continue to stroke. Those that had peripheral artery disease, 72% continue to smoke. So how innovation can contribute to move forward on, to decrease the risk? If you heat the tobacco up to 400 degrees Celsius, there is no burning, there is just heating. You have the vapor, you have the smell, but you have not burning the tobacco, which produces all the toxic carcinogenic substances. So we can define a group of devices that do not burn the tobacco and are associated with significantly lower damage. Now, among those are many: electronic cigarettes, hidden not burn devices, etc. And those are associated with decreased harm, significantly decreased. In many of them, there are 90 or 95% less damage of having chance to cardiovascular disease, to lung cancer, etc. Those are also tobacco products. They contain nicotine. By the way, nicotine does not cause damage. It causes addiction. No damage. One cigarette, the amount of nicotine in one cigarette is equivocal to 1 cup of coffee. Most cases, if they smoke 20, 30, 10 cigarettes, and this is mainly imports to the body carcinogens and substances that cause inflammation, and those can be solved by significant reduction. These are the groups of replacements. How we can substitute cigarettes. Now, this is an example of one of the devices developed to heat and not burn tobacco. The whole column, which is red, the 100%, the upper line, on the left, and all the columns, this is comparison to the conventional cigarette of 5 of the most known carcinogenic substances produced during tobacco burning. This is another study performed in Germany with similar results. If you switch to heat and not burn devices, you go to the left, you decrease the risk, you decrease morbidity and mortality. One of the bravest countries in this field was Japan. They introduced legally the heat and not burn devices, and smoking rate went down by more than 30%. In India, there is also a dispute which is justified. It's a very, very serious issue that has to be discussed, evaluated, and decided. In the UK, they decided this year to support switching. Everyone that switches from conventional cigarettes to any device that has been shown to lower the risk is supported. They cover the expenses of this switch. They buy and reimburse for people that buy devices that help them to quit smoking. In the last 3 years in UK, there was a decrease of about more than 5% in smokers. Now they are reaching something like 9%, and we hope it will go down further. In the USA, the FDA acknowledged the concept, and they are ready to discuss while they have enough proof about the degree of risk reduction and the safety of the products. So some devices are submitted and were submitted to the US FDA, and they are dealing with this, approving the concept of harm reduction. Harm reduction should be used maximally in those that are not able to stop smoking. And we need interventions of governments to adopt, support, and do research and implement harm reduction processes.
It was very, very informative talk, and thanks again for giving us an introduction to this very much required concept of harm reduction, which in India there's a lot of education required, lot of sensitization required, how this can benefit, and giving us the international perspective. That was very, very important from your point of view.
There are 5 disciplines that are required to change your behavior. In fact, Harvard offers a 2-year course on social and behavioral change communication, SBCC, 2-year course. My daughter has done that course. Sociology, psychology, anthropology, economics, and political science. India has taken a lead in today's environment. हम विश्व गुरु बने हैं, both in COVID-19 and also now G2 leadership. 2023 was the year of the millets, and during the G20, millets meal was served to the entire population. You showed about the cardiovascular sudden deaths. I came across a video in Singapore in a cinema hall. Somebody had a cardiac arrest. All they did was a simple thing. And that person revived. Let's come to today's end and we'll meet sometime. Thank you very much.
Thank you.